What is pancreatic cyst surveillance? Have you ever wondered how doctors keep an eye on pancreatic cysts? Pancreatic cyst surveillance is a medical monitoring process that helps track fluid-filled sacs in the pancreas. These cysts can sometimes change and might lead to pancreatic cancer or other complications. The goal is to catch any concerning changes early while avoiding unnecessary surgeries. Surveillance is especially important for certain types of cysts that have a higher risk of becoming cancerous. For example, intraductal papillary mucinous neoplasms and mucinous cystic neoplasms are monitored closely. On the other hand, cysts like pseudocysts and serous cystadenomas usually do not requiring this kind of surveillance since they are less likely to become malignant. So, how does this surveillance work? Doctors typically use imaging tests like magnetic resonance imaging or magnetic resonance cholangiopancreatography. These tests are non-invasive and do not expose patients to radiation, making them a safe choice for monitoring. In some cases, an endoscopic ultrasound may be performed. This test can include fine needle aspiration to sample the cyst fluid if there are any suspicious features, such as a large size or solid components. The frequency of these surveillance tests can vary. It might be every few months or as long as every couple of years, depending on the characteristics of the cyst and the patient's overall health. If a patient has a limited life expectancy or other serious medical conditions, the surveillance may be adjusted or even stopped. The main aim of pancreatic cyst surveillance is to identify early signs of cancer or any changes that may requiring surgical intervention. However, surgery is usually reserved for cysts that show high-risk features due to the complexities and risks involved. Most pancreatic cysts tend to remain just stable or grow slowly, allowing for safe monitoring over time. Interestingly, many pancreatic cysts do not cause any symptoms and are often found by chance during imaging for other health issues. This is why surveillance is so important. It helps avoid unnecessary surgeries while still keeping a close watch for any signs of cancer. Current medical guidelines stress the importance of personalized surveillance plans. These plans take into account the type of cyst, its size, the imaging features, and the patient's health status. In summary, pancreatic cyst surveillance is a careful and ongoing evaluation strategy that aims to protect pancreatic health and prevent cancer by monitoring cysts that could potentially become malignant. This approach uses advanced imaging techniques and selective testing while prioritizing patient safety and evidence-based assessments.